So today we are diving into a very massive topic on hormones. This is my friend and colleague Julie Brown. She is a advanced nurse practitioner and she has special certifications in bioidentical hormone replacement therapy as well as Functional Medicine Academy certified practitioner and also mold and detox certificate through functional medicine. So we welcome Julie here today.
Thank you.
For anyone who does not know me, and this is the first time that you're seeing my face, my name is Monica. I am a 20-year RN who has suffered with mental health and physical health, chronic issues for the majority of my adult life. And I have successfully weaned off of all of my antidepressant medications, which caused a protracted antidepressant withdrawal for the last year and a half. The withdrawal period started about 3 years ago, and it has gone a year and a half now beyond my last dose of antidepressants. During this time, we found out that a lot of my issues were directly related to hormonal imbalances. And Julie here is not only a colleague, but she is also my practitioner, and I love her dearly and highly recommend her. So if you are in Florida or Colorado, I think those are the only two states that you are practicing in right now. I really strongly recommend that you get in touch with Julie, and we will have all kinds of contact information available at the end, and it will be posted in the comments so that you can reach Julie if you have any hormonal needs. Welcome, Julie.
Thank
If you would
you.
just kind of introduce yourself and go over anything that I missed here.
Okay, yeah, no, you did a great job. So I'm Julie Brown. I'm a nurse practitioner, board certified, licensed in Colorado and Florida. I've been in healthcare for, embarrassingly, almost 30 years at this point, 28 to be exact. And I have my own functional medicine practice, having been on the provider side and the patient side through my own personal health journey, discovered the amazing world of functional medicine. And having been dismissed by three providers, three specialists with my own personal health journey issues, I started ordering tests on myself and got to the root cause of what was going on. And I've been symptom free ever since. So I am very passionate about having patients know that I hear you, I see you, I believe you. I have been on the patient side. I live in the provider side. So I've been on both sides, and I help you navigate that journey and really get to the root cause. And I feel like hormones, if we can balance hormones in your gut, that's 95% typically of getting you restored and balanced and better.
Yeah, I agree. 100% I agree. So,
Yeah.
so thank you so much for being here. We're going to go ahead and get started with just a couple questions, and we're just going to see where this conversation takes us. So, from your clinical perspective, how often are hormonal imbalances mistaken for mental health conditions, and specifically that are diagnosed as primarily mental health when the underlying cause is hormonal?
Hormones are honestly like, I truly feel like the foundational invisible layer behind most mental health struggles and gut microbiome. So 80% of our feel good hormones, immunity, all of those things, that connection between our gut and brain, is in our gut. So if we get the hormones balanced, the gut balanced, that makes a huge difference. And when I say hormones, I don't just mean sex hormones. I mean that's your estrogen, testosterone, progesterone, but also thyroid and cortisol and insulin regulation. So once we can get all that stabilized, usually that helps you become more resilient and helps you get better over time. I've lost count on how many patients come to me who say, like, I just, something's not right. I just still feel off, but I'm being told everything's normal. And when we look at that gut brain axis, sex hormones, cortisol, insulin, thyroid, and balance that, it really, really makes a big difference. Anxiety, heart palpitations, depression, sleep disturbances are very common in my patient population, and they were being put on antidepressants, anxiolytics, so anxiety medications,
Mhm.
and they end up needing to go up on doses, having side effect issues with those. And when we do that deeper dive and do the gut microbiome testing and the all hormone testing and balance it, it really makes a world of difference.
Yeah, I feel like that is my case also. My husband and I have really done a reverse engineering look at my history,
Mm-hmm.
and it started as a teenager with being put on birth control at 13 years old and, for heavy periods. And then I definitely had very bad, not menopausal, but postpartum issues after both of my children. And after my second child was born, that's where I really went off the deep end. But I also had endometriosis, and many people out there are having PCOS and all of these things that are, I mean, they're affecting our hormones, which affects our mental health, it seems like. So,
100%.
yeah. What patterns made you realize that hormones were the missing piece in these cases?
Honestly, looking at your standard labs, and I think we need to kind of make sure everybody understands this piece as well, is your conventional lab ranges for what's normal is really meant to check, is the check engine light on or off? So we're looking for major red flags, and that's how we're trained in the commercial space. So when you go and you're not feeling well, you're not sleeping well, new anxiety, worsening anxiety, hair loss, unwanted hair loss, skin changes, emotional lability, depression, uh, if you're if you go to your primary care team, they're just taught in that conventional range, and we're just looking for the check engine light on far either end. Whereas the functional medicine space is looking for, like, okay, it might look normal on paper, but what's the optimal? So for me, most of my patients, I mean, I have yet to have anybody come to me. Well, they come to me and they say, look, but they're telling me my labs are normal. It's usually at least 10 markers or more that I find that, yes, are normal per conventional range, but are abnormal or not optimal in the functional range. And everyone's different. And so the trends that I see are normally thyroid is not optimized. There's undiagnosed insulin resistance because insulin level is not routinely checked. Salivary cortisol is rarely checked. I don't have people come to me with salivary cortisol unless they've been to another functional medicine doctor. So that's important too, because then we're looking at your cortisol pattern over a 24-hour window, which can cause sugar cravings, weight loss resistance, hormone imbalances, irritability, brain fog, like all the things. It affects your libido. So I don't know that there's like set trends because every human is unique, but it's not just you need estrogen, progesterone, or testosterone. Those are only like three out of like six pieces to the main pieces to the puzzle. So it's not that you're out here because you would have been told by your primary care team. It's that you're not optimal for you, and it's the thyroid, the cortisol, the blood sugar, the insulin, and the sex hormones that we're looking to paint the full picture and optimize you. And the treatment plan is different for everyone as well. I'm digressing. I don't think I'm answering your question good enough,
No, you
but
did. You did. Let me pull it back though, in case our viewers are not aware. When we're looking at the lab values, so we get our labs back, and
mm-hmm.
there's a range on the labs. That range, my understanding, is the standard for the people. And we have a very sick population. So that range is based on that sick population and not what is optimal for human life.
Correct.
Okay.
I concur. Thank you.
Okay.
You said it way more succinctly.
I've practiced.
Yeah, that was good. That was good. I was like, wow, we need to snip that.
Right. So why do you think hormones are still so under discussed in mental health treatments? I know we just had the black box warnings removed, and that is a major win for hormone replacement therapies, but so many of the symptoms for hormonal imbalances are directly related to our mental health, but it's still very under discussed. And oftentimes we have anxiety or all these symptoms, and we're sent to psychiatry, and there's no testing that's done for an underlying cause. And they jump straight to psychotropic medications, antidepressants, SSRI, SNRI, mood stabilizers, antipsychotics, benzodiazepines, and even gabapentinoids are very, very popular in this clientele.
Yeah, so I think just having been in the conventional space for a very long time, and now in the functional medicine space, I have an appreciation and respect for, we were trained a certain way. There's not time to do the deep dive. It's open the car door, is the check engine light on or off, address those things. We don't lift the hood. We don't have time to lift the hood and do an all-point inspection. So I think hormones are scary because they know just enough, but don't have the deep dive medical training to truly appreciate the ins and outs. Hormone replacement therapy is not for everyone, depending on if, like you mentioned, the PCOS, the PMDD, the endometriosis, like everybody's different. And so being able to interpret those labs and interpret them at the most appropriate time of a cycling female sex. So if you just go get your hormones done, let's say you have a period every 28 days, and you just go get your hormones done on any day, any time of the day, your hormones are only most accurate on a set 48-hour window per month. And that's in that cycling female population. So your estrogen and progesterone and cortisol directly shape your brain chemistry. Like your estrogen is all about like serotonin and dopamine. There are feel-good transmitters. Again, your gut makes up 80% of serotonin. So if you have leaky gut, just fixing that is huge for those feel-good, hormones. Your progesterone is your calm queen. She's like the GABA receptor. She like is your stress resilience, your ability to like multitask and to sleep well. So think of it as like nature's tranquilizer. So progesterone is really good for that. And estrogen is really important for sharp cognition. It's great for bone health, emotional regulation. And when they're all meant to be balanced together. And then I don't want to leave testosterone out because I think of it as a male hormone, but women equally need balanced testosterone as well. And I think of that as like your confidence queen. Like that's the one that like is, you got a little extra pep in your step, libido is healthy and thriving, great muscle recovery, like you're eager to go work out or get that extra activity in. And when that's not balanced, like it just, so they're all equally important.
I'm glad you brought up the testosterone. I recently saw a hormone specialist who said that her very first hormone that she addresses, even in female population, is testosterone before she even looks at estrogen or progesterone levels.
I love that because and women, they're like, it's seen as a male hormone. Arguably, like we have more than they do. Like, it's so important. When our estrogen levels tank and progesterone levels tank, and when all three tank through perimenopause and menopause, our Alzheimer's rates go up, our bone fracture risk goes up, our recurrent UTI rates go up. People die from urosepsis, which is when a urinary tract infection goes into your bloodstream and you end up in the ICU. There's a high mortality rate, and that is directly related to estrogen levels tanking, and it's completely preventable, which just makes me so sad.
Right. I like to use the word anger over sad.
Yeah. Yes, because it's completely preventable.
Right. So,
Yeah.
so let's break this down at a physiological level. How do estrogen, progesterone, and cortisol directly affect the brain chemistry? Can you talk about that a little bit?
I feel like, the simplest way to say it would be to think of them as like being part of the orchestra. Like so you want, like these hormones act as like conductors within the nervous system. And so they all need to be balanced. They're helping us, some are helping us rest and digest, some are helping us with fight or flight, especially like with the cortisol. The cortisol, think of, you hear the word cortisol and most people are like, okay, cortisol, the adrenal glands, but also like your fight or flight, maybe more so than the word cortisol. But also like your DHEA comes from your adrenal glands, which then it helps convert into estrogen, progesterone, and testosterone. So that HPA axis or major highway from your gut to your brain needs to be like not 5 o'clock traffic. It needs to be wide open and flowing. So they all have to be balanced. And if any of them are out of balance, then that's initially your body. We were beautifully made and we have backup mechanisms for a backup mechanism, but we want our bodies to be thriving in the primary mechanism because eventually the backup mechanism becomes inefficient and we're like pressing the gas on an empty, the gas pedal on an empty tank. And then your body's like, okay, I'm done. And we want to avoid that like white flag with the various systems, especially our adrenal glands. We need our adrenal glands to thrive. So whether you're literally being chased by a tiger or you're just so chronically stressed, your body perceives that stress as being chased by the tiger, like literally or figuratively, like it just, or hypothetically, I should say. And so we want to protect our adrenal glands. We want to protect that HPA axis. We want to protect our gut, which directly communicates to our brain, because we want all of them to be beautifully balanced as a conductor with the orchestra. Like you can't have, you know, the trumpet player and the French horn player and the bass player and the flute player all playing a different piece, because then it's going to sound like chaos, which is what happens when all of your hormones are out of balance. And when we're all playing the same piece and we're watching the conductor, it should go smoothly and be beautiful and
Yeah.
balanced.
For sure. That brings me to this next question. And this question is very, very important to those who are deprescribing from their antidepressants, or maybe even haven't started the deprescribing process, but they've been on their antidepressants long term. It has been shown that these antidepressants affect the autonomic nervous system in our body. So, what role do the hormones play in regulating the autonomic nervous system?
So, you know, synthetic medications like the ones that you just mentioned, the antidepressants, the benzodiazepines, all of those sleeping agents, long-term use, those are synthetic chemicals that, for what it's quote fixing, which in my opinion it's blocking natural innate mechanisms that our bodies are beautifully meant to want to fix and to regulate and balance. So it long-term use of those prescriptions can absolutely disrupt the hormone balance. You know, quickly I'm going to go back to your oh my gosh, your birth control example. So with birth control, that is synthetic. It's meant to block your natural production of hormones so that you don't get pregnant. It's doing its job. So when you have a period, a cycle on birth control, that is just a hormone withdrawal, bleeding. That is not a natural female period cycle. It is a hormone withdrawal. So we're synthetic medication blocking natural mechanism, pregnancy. Mm-hmm. And when you have the sugar pill week, that is not a normal period. That is a hormone withdrawal period. So now let's fast forward back to the antidepressants.
That's interesting. I did not realize that, but that's huge.
Huge, because the health benefits come from our bodies being able to do what we were made to do naturally. And so synthetic things are, I mean, there's a time and a place for prescriptions, but long-term use really affects that natural balance and those mechanisms that our bodies were born to do. So it alters the feedback loops. It blocks natural mechanisms, which then has downstream effects like that domino effect, in my opinion. It also modulates like your intensity of your withdrawal. It can amplify irritability. It can affect like sleep. And sleep is so critical. Like if we are not getting restorative sleep, nothing can work effectively. I mean, literally, like people who, like, you can become psychotic from severe sleep deprivation.
Right.
And think of like when you try to wean off, which you could speak to way better than I can, but when you try to wean off these antidepressants and you're dialing in the gut and other balancing things, the withdrawals are so intense and severe. And so think of like what that has done to your brain chemistry, that you literally withdrawing from it as if you had methamphetamines or heroin or any of those other drugs. It is real, and it has to be monitored very closely, done very thoughtfully and slowly over time, and even more so the longer you've been on them. So
right.
Again, I'm
no, this is great. And I like that you said that the longer you're on them, the longer it takes to come off these medications. And it's not just antidepressants or psychotropic medications that this is the case for. This is the same in my experience, in my opinion. This is the same for heart medications or any other medication, even if it's something that's controlling acid in your stomach, which please don't do that. If you're listening, let's keep the acid where it needs to be in our
That's
stomach.
that's another episode.
It is another episode. That's another episode. We're not going there today, but
No.
it's not just antidepressants, but antidepressants are very they're very physically dependent. We become very physically dependent on them. And the longer you're on them, the longer it's going to take to come off in a safe manner. And so that's very I think I'm getting a little off there too, but
No, because
yeah.
I go to like you. My thing is so in the conventional space, which by the way, I still work a few days a month in the conventional space, so I can keep my toes wet and be on top of things and see what the latest and greatest trends and things like that. But you, we don't have time to see 20 or 30 patients in a clinic day and ask the deeper questions.
Right.
We're scratch the surface level. Is the check engine light on or off? No, yes, move on. And it's not because we don't want to. Trust me, we all went into medicine to help people to get answers and to feel better. But we in the functional medicine space, whether you see me or another functional medicine provider, wherever, we have the time built in. We see maybe 4 to 6 people a day so that we can do the deeper dive. Here's what it's why is the depression happening?
Right.
Why? Instead of like, here's a pill. So a pill for the ill is a band-aid.
Mm-hmm.
So my thing is like, why is the depression happening? Is it a gut imbalance? Is it situational? I mean, because there's a time and place where people just need a little extra support in this current time and space. Is it a chemical imbalance from something else? Is it that your cholesterol is way too low?
And
Because
that's something that you taught me. I had
yes,
no idea. I had
yes.
no idea. And we're trying to lower cholesterol on everybody
Oh,
nonstop.
driving it down. Oh, if it's 100 or lower, that's better. Our brains thrive on cholesterol.
Right.
Our hormones thrive on cholesterol. That's the backbone to your sex hormones is cholesterol. So the
Yeah.
DHEA, like I said, from the adrenal glands is the precursor to the immediate three, estrogen, progesterone, testosterone. But cholesterol is grandma. I call cholesterol grandma, DHEA mom, and the sex hormones kids. And when you're driving it cholesterol down into the low 100s, that, and you guys can all look it up later, that significantly increases your depression and suicide rate by over 200% when you're in those low
Crazy.
100s. So my thing is like, okay, I don't want to just give you an antidepressant unless it's something situational, acute, there's a crisis. But like, why? Is it gut? Is it low cholesterol? And those types of things.
And you're hitting on my favorite line. And I preach this. Depression and anxiety are never the primary diagnosis. They are always a physiological problem in the body. And we need to find what the root cause is. So, and what is that? Is that today we're talking about hormones because hormones is a huge physiological problem in the body that manifests into symptoms of depression and anxiety and brain fog and all the other things that we're being medicated for. So,
Yeah,
yeah.
and just a little plug, like guess why when you've been going along in your 20s, 30s, cholesterol levels look fine, and somewhere in your late 30s and early 40s, you all of a sudden your primary care team goes, "Oh my gosh, your cholesterol is like gone up 50 points. So you need to go on a statin." Well, guess why your cholesterol is going up? Because our body, I'm going to say this over and over again, our bodies are beautifully made. It
Mhm.
knows what it's doing. Cholesterol is the grandma, like I said, to the DHEA and to the sex hormones. So your body recognizes a decline in perimenopause of your hormones. So it increases cholesterol production to make more hormones because it's recognizing a deficiency.
So
So
it's
that's why all
correcting
of a sudden you're
itself.
like, I've been doing I haven't changed anything. I haven't changed my diet. I haven't changed my routine. Oh my gosh, I guess I need to go on a statin so I don't have a heart attack. Nope.
We're not going on the statin conversation today.
Another episode.
So you touched on this a little bit already, but let's talk about a little bit more. How do they influence neurotransmitters like the serotonin, the dopamine, and GABA specifically? You talked about, and one of the things that I love that you told me, and I remember it always, is estrogen being the drama queen, progesterone being the chill queen. And so, and that is very much, I had a lot of symptoms with the autonomic nervous system, but it was directly related to the hormones affecting these particular neurotransmitters in our brains.
Yeah, I see. So, I mean, there is that, again, that gut brain, the HPA accesses the main highway to your gut and brain. So, I see patients with like chronic dysregulation, tachycardia, so rapid heart rate,
Mhm.
which usually is like described more so as like palpitations or fluttering in your chest. Insomnia is a big one. And typically it is adrenal depletion. So your fight or flight, your adrenal glands, directly related to your nervous system, are just putting up that white flag and they're super tired. So I'll see people like with poor sleep, blood sugar swings, energy crashes, emotional lability. So meaning like your emotions are all over the place, commonly feeling like wired and tired. And that's because your stress hormones are still firing, but you're hitting the gas pedal with no gas in the tank.
Right. Yeah.
So there's a lot of things that I talk about with uh, box breathing, like vagus nerve breathing, to help, because that is like an easy thing that you can do that nobody else knows you're doing it. You
Mhm.
can do it anywhere, and it's not like you're just deep breathing. Like you can do it in the car, you can do it wherever. You
Right.
can do it during a meeting. So that grounding, that that this is something super simple, and I think we've talked about this. Is I call it 10 before 10. So it's 10 minutes of sunshine on your face before 10 a.m. Talk about direct brain connection. That literally, that 10 before 10, 10 minutes of sunshine on your face before 10 a.m., activate your pineal gland, which is in your brain, which is
Mhm.
your melatonin producer.
Right.
Just that through your eyeballs, not looking at the sun, obviously, but like just taking in and soaking it in. Activate your pineal gland for that night's sleep. That is like a free, simple thing to do. Grounding, like walk barefoot on the grass or on the
Yeah.
sand. Like that is the brain connection. These are all natural, free things that we've gotten away from nature. The further away from nature we've gotten, the sicker we've become as a
A
population.
100%. I believe that. Yeah, you said grounding, and I'm really glad that you brought that up because grounding, and when I started looking into grounding, when I started doing the holistic care and looking into holistic modalities for myself, I started looking into grounding. And look, I'm an evidence, as you are, I'm an evidence-based girly.
Yes.
Like, I want to know, what science has proven these things to be true, and the effects of grounding on our cardiovascular system is incredible. And
Yeah.
it's look, I tell you, I feel like a lot of my husband's issues were solved, his cardiovascular issues were solved because I was making him ground every day. It's
And he
look,
wasn't
I might
grounded.
I might be taking a little too much credit.
Yeah. You weren't grounding him. We were practicing grounding exercises.
Yes, right. But the HRV, the improvements in HRV, the heart rate variability, for those who are not familiar with that term, and also the coagulation factors. So the grounding directly affects how our blood clots in our body. And that's incredibly important, especially for people who have previous heart attacks or stroke potential. Those
Mhm.
are so grounding can literally potentially save a life, in my opinion,
I
just
agree.
by taking care of your cardiovascular system and making the blood so it's less viscous.
Yeah, less
So
thick. Yeah.
yeah.
No, I think I love like the way like we explain things differently, and I love it because like between how you're saying it and how I'm saying it, hopefully people are connecting and like, oh yeah,
Yeah.
now like the light bulb's going on. I feel like there's been
Right.
several light bulb moments already.
Yes, absolutely. I agree with that. So
So, what are your thoughts on just daily walking and Tai Chi and yoga and journaling and meditating and things like that?
I do it all, and it's so important. And
Yeah.
it's so, and I've talked a little bit on my socials about this, and I think I've told you as well, but and this goes into a little bit more of cellular function, but it's directly related to hormones. is when I was healing from the antidepressant withdrawal, I was exhausted all the time. I would go out, there's this 2 mile loop around the outside of my neighborhood, and I was trying to walk. And I was walking at like a 42-minute pace, which I was so embarrassed of. I used to do the 5Ks and the boot camps and all the things. And now it took me 42 minutes to walk a 2 mile lap around my neighborhood. And I was exhausted and my muscles ached and I was short of breath. And then I started looking into mitochondrial health and cellular health, and I started supplementing with glutathione, PQQ, and CoQ10. And within 2 to 3 weeks, I was intermittently jogging. I dropped more than 10 minutes off of the time for that 2 miles, and I was invigorated. My shortness of breath was gone, and so that is so important. I feel like um, it's not only the things that we're doing for the grounding and the journaling and the walking and getting outside and getting the sun on our face first thing in the morning. Those are the things that are affecting our mitochondria. And the mitochondria,
I'm sensing the next topic for our next episode.
I've already blogged about it. Y'all go to my website and check out my
Okay.
blog on the mitochondria. But yeah, it's huge, and all of these things that are woo woo or what do they call it now? Not founded in science and all that kind of stuff.
Ugh.
They
Yeah.
are absolutely founded. Just because it can't be proved in a double blind study or a placebo, I
Yeah.
mean, it's it's um it's really sad what we've taken away from nature and the earth and our magnificent bodies, as we've already talked about. So for
Agreed.
sure.
Agreed.
So let's go ahead and move on here a little bit. We've talked about the nervous system and the neurotransmitters and whatnot.
Mhm.
Um, we're going to go in a little bit more with the nervous system dysregulation because that is I'm sure you see a lot of nervous system dysregulation. We see it in populations all over the place, but is vitally important for those who are deprescribing from antidepressants or in the antidepressant withdrawal group, because nervous system dysregulation drives so much. It drives nearly every function in our body.
Uh-huh.
And so, what hormonal patterns do you see in patients who have chronic nervous system dysregulation?
The biggest one I would say would be a flattened cortisol curve. So your cortisol levels should be the highest in the morning, and then the next one, next lower, lower, lowest at bedtime. And like I mentioned earlier, that's best measured in saliva over 4 samples over the 24-hour period. So I see flattened cortisol like curve. So it is sad. It's almost like a straight line on the EKG, which we know that's a problem. So yeah, so typically that's what I'll see. So again, you should be the highest when you wake up first thing in the morning, and then lower, lower, lowest. And I see women, and I treat men as well, but they'll start like their morning dot is like the lowest, flattest, saddest, and it's just in. So you're already like operating on fumes before your feet even hit the ground. So that's typically what I see when there's significant nervous system dysregulation. And like one of the underrated sex hormones is progesterone, because that's your calm queen, like nature's tranquilizer, chill. And when progesterone levels are really low, and that can be when you're in your 20s and 30s, or it doesn't have to be just perimenopause, menopause. This can be younger people suffering with hormone imbalance. That progesterone being really low is your stress resilience, your restorative sleep, your ability to multitask with a smile on your face, and your emotional stability, paired with estrogen too, because estrogen's your mental emotional regulator also. But it's really sad because these are simple lab markers that tested at the right time of the month, depending on if you're male or female, can really, there's simple solutions, and it doesn't have to be bioidentical hormone replacement therapy. There are very natural things that we can talk about through herbs, through lifestyle, does not have to be a prescription to help support you and balance you.
Right,
All
right.
right, I hope that answered that.
No, it does. And I think you kind of already answered this question, but I'll ask it again in case there's anything that you want to add is how does cortisol dysfunction actually present clinically? So what is your first indication that cortisol is the problem?
So uh, it's that classic, which I think most people can relate to it. So without me going into like specific markers, like that wired and tired.
Yeah.
Wired and tired is the easiest way for me to explain it. And they feel like they're going on fumes. They know, like they're just like I just like it's just almost like that. Or I have people explain it as the hamster wheel. Like it's just like or Groundhog Day. Like every day is like Groundhog Day, and just go go go. And like I close
Right.
my eyes at night, and I open them, and it's like I didn't even sleep. So that wired but tired, or they
Mhm.
have horrible insomnia. So I see like horrible energy crashes, which they're chasing with caffeine and energy drinks and all of that. Which that we could have a whole episode.
Look, that was me. That was me at one time for
Well,
sure.
because you're desperate. You've got you're wearing the spouse hat, the career hat, the mom hat, the life hat, all the things. And sometimes there's a set group of us that are also now like we're raising kids, but we're also supporting aging parents. So there's that people
Yes.
are going through. And so in society in general is do more with less and go 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 go. And now having the opportunity two times to be like travel outside of the country, they are shocked at how work is prioritized,
Hmm.
and it's life has to fit into work. It should be work fits
Right.
into life. And in the United States, I mean, I love this country, but it's backwards.
Priorities
So,
are backwards for sure.
emotional instability, the energy crashes I talked about, blood sugar swings, um, sugar cravings. So intense sugar cravings, which then gets you into the insulin resistance, blood sugar changes, weight loss resistance. And if somebody comes to me and they say like, I don't know, I cannot get this stubborn belly fat off.
Hmm.
We have cortisol receptors everywhere. So most of the most concentrated section of cortisol receptors is our midsection. And so when somebody says they put on 10 to 15 plus pounds, mostly on their waistline, then I'm like, ooh, cortisol. We need to look at cortisol. Sorry, that was a long answer
Yeah.
for.
No, 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 that's good. That's really good. Um, you said something that really, I lost it now. Maybe it'll come back. But so this is something that I have personally experienced. And I think we've already kind of touched on it, but let's go over it again. Um, let's I'd like to focus on it a little bit. So hormonal imbalance can contribute to things like tachycardia, and then we've already talked about the insomnia and sensory overwhelm. And is there anything that you can add to what's really going on there? Is it the progesterone in women, that calming effect, or is it the effect on all of these different hormones on our nervous system? What would you say would be the biggest contributor to these particular symptoms?
So it's all the things that we've talked about with the cortisol, the insulin, thyroid, uh,
Mhm.
estrogen, progesterone, and testosterone. So I would say to answer your question more specifically, typically it's a progesterone and estrogen imbalance, which can impact the thyroid. So I have women who have had underlying like mild anxiety throughout their life, but now it's just out of proportion. They're
Mhm.
needing the Xanax. They're seeing a therapist now. They're going on like they're on three prescriptions by the time they see me to
Right.
band-aids.
Right.
And it's like they just, they did an EKG on me. They did my blood labs. Everything looks normal. It's not anything with my heart. So it's just high stress. They just said I need to
Mhm.
de-stress and sleep better. So here's a sleeping pill. I'm like, oh my goodness. So
Yeah.
heart palpitations, which then to me goes hand in hand with anxiety because usually it's this like spiral effect that happens. And then I feel like people who are in the medical profession or who have family members who are in the medical profession, they almost know too much for their own good. So they get in their own head, and then it's just this like, and then we have all of the trackables and wearables, which arguably they're helpful. I even have my own on. But I think that there's an element of we become obsessed with tracking data,
Right.
which I think there's a healthy balance. So I think that can breed some anxiety as well. I mean, I know we're talking about the chemistry of hormones, but I think that
Right.
there's environmental things that we
Always.
are, yes,
Yeah,
that
I
can
agree with that.
increase anxiety externally because we have all the internal anxiety and increased stress. and imbalance, and then you have all these external things that are now at our disposal because of technology. So it's just a double-edged sword. And so then we have to go back to the basics and the foundation of like, are your hormones balanced? And that's not just your sex hormones. Like people hear hormones and they just think sex hormones. I think are underrated superheroes if we can balance cortisol, measure salivary cortisol and balance that, and progesterone. If it's an anxiety scenario, I'm like, what's your progesterone? What's your cortisol?
You said something that, and you've said it a couple times about the racing heartbeat or heart rate. So something that I have experienced, and a lot of people in the antidepressant withdrawal community experience, is adrenaline surges. And I have been experiencing that recently, where it's not necessarily that I get tachycardic, where my heart's beating too fast, but I can feel it pounding in my chest and it goes all the way up into my neck. And that it's very uncomfortable. And then it brings on other symptoms that, like irritation, just being irritable because you're not feeling well. Like your body is not functioning the way it is, the way it's supposed to. Can you talk about how adrenaline surges may be related to hormones?
So the adrenal glands, so cortisol is what they're known for, but also a second, almost equal mechanism is the DHEA, which is the precursor backbone hormone to the estrogen, progesterone, testosterone. So the DHEA metabolizes into those three buckets. So the DHEA is primarily coming from the adrenal glands. So cortisol is the natural first line of fight or flight, let's go, you're being chased by the tiger, let's go. With chronic stress and dysregulation over time, that cortisol, it becomes less and less and less efficient. So like I said, beautifully and wonderfully made, the backup mechanism is adrenaline, which should not be the primary because it's like we're giving you a shot of adrenaline, which is just, it's like, to me, cortisol on cocaine. Like it is just
I can confirm.
rush, so cortisol is meant to do that job, but like more in a natural, like, and just enough, a regulated, balanced amount. But when that becomes depleted over time, you're still being chased by the tiger. That is where adrenaline becomes the backup mechanism, and it's way more powerful, which is why you have all of the physical symptoms, that discomfort of like, what's wrong, something's wrong. And it's usually what prompts people to end up going to the ER because they think they want to make sure they're not having a heart attack.
Right.
Because anytime you're saying I'm having heart palpitations, shortness of breath, chest pain, those are the buzzwords, and you're going to get a full cardiac workup, and guess what? Then you'll be like, oh, everything's normal.
Right.
And then you continue to have these cycles, and it can but nobody's looking at salivary cortisol. Nobody's looking at your hormones, including insulin, glucose, and thyroid, to make sure, because the thyroid can cause all kinds of nervous system changes in your body. And all the things that we've listed, I know we focused on progesterone and cortisol specifically, but the thyroid always has to be considered.
Yeah. Would it be safe to say that those who are in the antidepressant withdrawal community who are having these adrenaline surges, maybe we think that our nervous system is controlled, but really it's not, and we've just kind of learned to either compensate would be the best answer, is we're compensating for those symptoms that originate with the nervous system, but the body can only compensate for so long, and then you get these adrenaline surges that seem like it's new and something new, but really it's just an intensified. Does that sound?
Yes, because to me, over time, that chronic just beat down, beat down, beat down. Initially, your body is resilient and primary mechanism will work beautifully. But eventually, over time, and that's measured differently for people, and depending on the intensity of the type of stress also, I feel like. Mm-hmm. But the backup mechanism is never the preferred efficient mechanism. And I do feel like it's more intensified because now it's having to revert to plan B backup mechanism, and that's what throws things off. But that's how we were made, is to have a backup to the backup. And the backups are not the preferred primary neutralizing mechanism. And then I think that's why our symptoms are more magnified.
And that can be triggered from any type of stress. So if we're living in chronic stress, and we all have
Yeah.
a level of stress that our bodies get used to and accustomed to. But say you are at the stoplight and you're living in your chronic stress, but there's a motorcycle next to you that revs its engine, and that
Yeah.
can really activate that.
Yeah.
And if we're and it seems like it's not just the nervous system that's activated, it's activated by the adrenaline surge that's
Yeah.
coming on. Does that
What
sound
we,
okay?
yes, you're spot on. What we see, what we hear, what we smell, what we consume, what we feel. Like it's not just a sound or an argument or I mean, all of those senses are being taken into consideration. So your body keeps the score. And so I say, like,
Yes.
all of that gets, and that's a whole nother topic. That's a
Mhm.
book, and it's a great book for those of you that haven't heard of that book. But like, your body keeps the score, and so that's like just that stored up stress, whether that's from post traumatic stress, whether that's from, I mean, you could have chronic, intense, good stress, but
Mhm.
it's all stress is healthy. It's we're meant to interact and handle stress, but it's chronic over time. And it's not, you can't be like, well, that stress weighs more than that stress. Everyone's different, and how we handle it is different.
Right. And that and I've heard this said before, and I have to agree with it, is it's kind of like talking about trauma. And like we all have different traumas, but you know, your trauma and my trauma may not be the same, but our bodies react the same because our body doesn't know the different types of, they just see it as trauma. Like it's just trauma. It's
Yep.
not, and so the same thing. It's just stress. The body just sees stress. It doesn't put it into buckets as in this is a good stress or this is a bad stress and this is a really bad stress. It's
Mm-hmm.
just all thrown into one bucket.
Yep. Agreed. Agreed. I want to encourage people to let us know, like, if there's additional topics that they want us to talk about, if they want to
Yes.
reach out and have additional questions. I'll post it on social media with both of our links, and you will likewise. But this is just we've just barely scratched the surface. I've tried to keep it as high level as possible and not go super deep because
Yes.
I don't know who the listeners are and know what background or knowledge that they have. So I wanted it to be interesting enough that you could follow along, or for those that are more knowledgeable in the medical space are like, ooh, I learned a few new things today. That would be my
Right.
hope, that your takeaway from today's talk.
Yes. And we have a lot more things to talk about, and we will talk about these in future. If there's anyone out there that has, look, leave in the comments. I'm sure on all these different socials, there's comment sections. You can DM us and help us create a list of what do you want to know? What do you want to learn more about? There, one thing that I would like to talk about more is the different types of hormones and what they're used for, because I didn't know all the different hormones and how it was, this one is used for this and this and this, and the importance of all of them together. So that's something that we'll have to talk about too another time.
Awesome.
We're getting close on time?
Yeah. Yeah.
Okay. I didn't realize because we're an hour different and I always forget. I was
Oh.
like, oh, we've got another.
That's okay. We'll
So
let people have a break because we've been.
I know, right? But Julie, I really thank you so much. If you
Yeah.
would go ahead and tell everyone where they can find you, and
Okay.
we'll make sure that's posted in the
Awesome.
captions so that people can find
Yeah.
you.
The easiest way is on my website. So that's www.thefunctionaldifference.org. And I have a message little icon on there. Also, like, my first visit with me is complimentary to discuss concerns, goals, things that we could prioritize. And that first visit is always complimentary. And that's how you get into like my inner circle. And then we can chat like this and talk through what's important to you and what your goals and concerns are.
Awesome. Thank you. And if anyone is looking for help with antidepressant tapering, if you need help talking to your doctor, I do both doctor education and patient advocacy, and I help you deprescribe from your antidepressants in a safe manner. You can
Yep.
find me at www.solumroot.com. That's SolumRoot.com. Thanks, everybody. And thank you, Julie, so much for being here with me today.
Yeah. You're so welcome.
All right. Bye
Okay.
bye.
Bye.